So, quick video. I wanted to share with you a couple of thoughts about an interaction I had with a patient last week. So, let me preface this by saying I'm real cautious when I'm discussing treatment with patients so they don't feel boxed in. I don't want to guilt anybody into doing anything. I don't want to create a situation where they feel coerced into any recommendation I may make. I'm very cautious to make sure that they're aware of consequences, the problems and the consequences and the solutions, but I don't want them to feel like I've twisted their arm to do treatment. Now there's a fine line there, a gray area, and I think you can end up doing a whole lot of dentistry that some patients may regret after it's done if we're too coercive in our interactions with the patients. So let me share an experience that I had. I got a call from a patient's mother. This is a 20-something patient who's a student, really nice guy, came in for an examination, ended up identifying some periodontal disease, and at his age, in his 20s, fairly advanced, fairly generalized. It was a little more concerning than, identifying some localized gum disease in someone who's in their 50s, for instance. So, the conversation that I had with him went along the lines of something like this. Were you aware that you have gum disease? Gum disease is basically an active bacterial infection caused by a multitude of different bacteria that over time is the number one cause of tooth loss and also elevates your risk of heart attack and stroke. My concern is if it's left untreated, this will probably get worse, and as it gets worse faster. So, especially given your age, we want to try to treat this as soon as we can to mitigate and minimize any long-term issues with the gum disease. And then I talk through the choices for treatment. Right now you have a choice to do a basic cleaning, which will not treat the gum disease, or a 3-step process, which will start that treatment process for the gum disease. Opting to have a basic cleaning done in the presence of active gum infection is like taking your car to the car wash when you need an oil change. Yes, it makes the outside look really nice, but it doesn't treat the underlying problem and eventually can lead to big problems in the future. So usually a discussion along those lines with a patient helps them to understand, I came in for a cleaning, but that's not what I need. And sometimes we run across a situation where people feel like we're upselling them. But if we explain what's going on in a non-offensive and non-manipulative way, it can lead to a solid foundational relationship of collaboration moving toward, a healthier mouth and a healthier practice long term. So we had the discussion with the patient, and he was very interested in moving forward with the 3-step gum treatment that I had talked with him about. The scaling and root planing, the irrigation with an antibacterial rinse, and then the bacterial decontamination with a diode laser. And he actually made an appointment. He scheduled for that treatment. Now his mother called back in and wanted to talk to me about what I'd recommended for him and why we didn't just do the basic cleaning. And despite my best efforts, I couldn't really finish the conversation with this mother. She was very angry that we hadn't done just the basic cleaning, and got very frustrated with me that she had felt like I had manipulated him in to scheduling the gum treatment. And I'm very cautious about how I interact with these patients. I'm very cautious about making sure that I give them the choices. I talk with them about options that they have, but then leave it in their hands. And we do a lot of basic cleanings, prophylaxis cleanings for people who have gum disease. They opt for that, and I don't try to make them feel bad. I don't try to guilt them. I tell them this isn't going to treat your gum disease, but I'm happy to do anything I can to help. And let them make that decision. Now, there are a lot of doctors who will push back and say, I will absolutely not do a basic cleaning in the presence of gum disease. And I think at some point you have to draw a line, and it's not something that I'm willing to do indefinitely. But if the patient opts to come back into the practice and get a basic cleaning instead of the gum treatment I've recommended, if I have the conversation with them again, make them aware of the consequences of inaction, and then give them the choice, then I'm okay with doing a basic cleaning for them, as long as they're willing, to have an open conversation with me. You get some people that tell you that periodontitis, gum disease, is a hoax, and that scraping below the gums is just so you can bill more. And why would I do a $1,200 cleaning when I could do a $59 cleaning? Why are you doing this? It's so you can make money to buy a Mercedes or whatever. You get patients that are pretty frustrated with you sometimes. So I would suggest being very cautious in how you present that to patients. Any treatment for that matter, whether it's a crown or a root canal or a filling or a veneer or a smile makeover. Anyway, this conversation ended with her hanging up on me as I feel like I was trying to be very diplomatic in my explanation. I'm sorry, ma'am, that you feel this way. My training dictates that I explain these things to you and your son and, any other patient I have, because if I don't, I'm not doing my job, and ultimately it puts my license on the line, and I'm required to identify concerns and discuss treatment recommendations based on evidence-based dentistry. So I'm obligated to do this. I certainly gave him the choice to do a basic cleaning. He opted to go ahead and do the cleaning and to schedule for the gum treatment. And she kept coming back to, well, you pushed him into it. He's a young guy. Why did you coerce him into this? And I would have liked for her to have been present during that initial examination. It would have been nice to be able to actually demonstrate to her, here's a healthy pocket, here's a 3, here's a 5 or a 6. Do you see the difference in the periodontal probe marking? You see how much deeper that is? Let's talk about what that means long term given his age. It would have been nice. I even suggested that she take him in and have a second opinion if she had any concerns with a dentist who maybe she'd never seen before, maybe she had, just to get a second opinion from the standpoint of what he or she, the new dentist, would recommend for the gums. But if they didn't do a periodontal evaluation measuring the gums, then they aren't really doing their job if it's not happening periodically. So we try to do it yearly for our periodontal patients. We try to do it quarterly or every 4 months, depending on their recall. Anyway, so I wanted to share that experience with you, with a warning. Be very diplomatic. Well, be very cautious that you don't try to manipulate your patients, guilt your patients, twist their arms into doing treatment. I think with a good, clear understanding of here's the problem, here's the consequence, and here is the resolution I'd suggest, then we can get a lot more done and maintain a healthier long-term practice growth than if we push patients into treatment, if we make them feel like if you don't get this done today, your head's going to pop off. I mean, honestly, there is very little dentistry that's life-threatening, very little treatment needed in dentistry that's life-threatening, if you know what I mean. There are some things, yes, it increases risks, and et cetera, and giant abscess, absolutely. IV antibiotics sometimes are needed. But most of what we do is, it's not going to be an issue in 5 minutes, maybe even in 5 days, but probably within 5 years. Now, we want to create a sense of urgency. It's very important. The biggest benefit I can give to my patient, rather than twisting their arm into doing treatment, is to tell them how much of a benefit starting that treatment sooner is going to be, because it's going to be cheaper now fixing it with just a crown, whereas if that decay gets larger and the tooth fractures, now we're going to need a root canal and a crown, or the tooth may not be fixable and we'll have to talk about an implant. So giving them benefits rather than detractors, and making sure that we're open about actual consequence and potential consequence risk. So that being said, urgency is critical. This is what could happen in the end. These are some risks of leaving it untreated, but ultimately empowering the patient to make that choice. So, like I said, that patient's mother hung up on me. I tried to give her a call back to see if we could finish that conversation. Was unsuccessful, I imagine. She just didn't want to answer and talk. Hopefully, if she does a little bit of research and sticks with mainstream websites that are reputable, that she may come around. Anyway, that's all I've got for you today. Thanks for watching. Please comment, send me any questions you have. I'm happy to do some specific videos, discussions. I've got some more CEREC stuff coming up that I'm going to be posting online here in a little bit on my channel. But yeah, that's all I've got. Thank you. Bye.